Dear audience, thank you for joining me in my 9 months progress report on my PhD thesis titled Oncoplastic Breast Surgery and its Clinical Significance. My name is Loretta Nyirády. I'm a 5th-year medical student and also an MD PhD student at the Department of Surgery, Transplantation and Gastroenterology. My mission is, of course, to aim for perfection in breast reconstruction, and my vision is to find the best technique or techniques which result both in the safest oncological and also the best aesthetic outcome. In the past 9 months, I dove deeply into 2 crucial areas of oncoplastic breast surgery, so I would like to share some insights into them. Let's begin with the first one, which is investigating the safety and effectiveness of volume displacement and volume replacement techniques in oncoplastic breast-conserving surgery. So every 8th woman has some kind of breast cancer, which could affect not only their physical health, but also their mental and sexual well-being. However, this could be mitigated with some kind of reconstruction, which could earn them back their health, emotional well-being, and also their self-confidence. There are 2 techniques which you could use. On the right side, you can see some of the volume replacement techniques using perforator-based flaps, and on the left side, there are the volume displacement techniques utilizing local breast tissue. And my aim is to compare these different oncoplastic techniques and their outcomes by answering the clinical question, which is the safest and most satisfactory method in oncoplastic breast reconstruction surgeries. By involving the population of women underwent breast-conserving surgery, the 2 intervention groups are volume displacement and volume replacement. And primarily, I would like to examine the patient satisfaction and secondarily, the oncological safety and the complications. We hypothesize that reconstruction with volume displacement techniques are associated with better outcomes. So we conducted our systematic search in these 3 databases, and we used this search key. In the first part of it, you can see the different techniques, and in the second domain, the OBCS and its synonyms. Through my selection flowchart, we started with more than 17,000 articles, and after every selection, we ended up with 46 eligible full texts. So let's look at my final results. Here you can see the pooled proportion for overall satisfaction after oncoplastic breast-conserving surgery. Many women are afraid of dissatisfaction because, as I mentioned before, this could affect not only their physical health, but also their mental and sexual well-being. In the 2 sides of my picture, you can see the 2 subgroups, volume displacement and volume replacement, with an overall patient number of 694, accounted with more than 500 events and providing a pooled proportion of 83%. These results show no statistically significant difference between the 2 subgroups. My second figure is a complication, hematoma. Here we use the same unit, proportion, and the same subgroups. Here we had more than 2,000 patients with 75 events. And there was we couldn't prove any statistically significant difference across volume displacement and volume replacement techniques. And the hematoma occurrence was really low, with an overall incidence of 4%. And my third plot is an oncological safety factor, which is a positive margin. Here we use the same unit, the same subgroups. And here we couldn't find any dissimilarities between the 2 methods regarding this parameter, and the overall incidence was really low with 7% in each of the groups. So of course, our study has its strengths and limitations. As I previously mentioned, we used large data samples and we included every single technique which we could. However, these articles are only single-arm studies, and because we wanted to examine the patient satisfaction, which is a subjective outcome, the risk of bias and also the grade assessment is really high, but it's also the nature of the study. And we try to stick to rigorous methodology and a comprehensive design. So after our thorough examination, our results suggest that both volume displacement and replacement techniques yield equally satisfactory, oncologically safe, and complication-free outcomes. So practitioners can use both techniques equally. However, there's a pressing need to develop a universal patient satisfaction tool. So currently I'm in the manuscript writing status. I'm done with the second version of my manuscript, which is right now under revision of my SMS and my supervisor. And my aim is to submit this article to the Plastic and Reconstructive Surgery Journal. Let's move into my second project, which is investigating the safety and effectiveness of polyurethane breast implants compared to alternative ones in reconstruction after mastectomy. So not only every 8th woman has breast cancer, but it's also the second leading cause of death. And mastectomy rates are increasing. For example, in a study between 2009 and 2020, it increased from 10% to 25%. And until these days, it has a strong stigmatizing effect, which can be also mitigated by reconstruction, earning pleasing results and a better quality of life. Here you can see the indications for mastectomy, and let me highlight the most important ones. For example, if the tumor is larger than 50 millimeters, or if there are multiple malignant lesions, or if it's a local recurrence. So let's move into the polyurethane implants, which are regular silicone implants coated with polyurethane foam. These silicone implants show promising results both in acute complications like hematoma, infection, seroma, and also in later complications like capsular contracture or implant rotation. And last but not least, the overall patient satisfaction is also better with these implants than with the alternative ones. So my aim is, of course, to compare these different implant-based reconstruction techniques and also their outcomes. My clinical question is that which implant-based reconstruction demonstrates the lowest rate of complications and the most satisfactory outcome in patients undergoing mastectomy? Here I would like to compare the polyurethane implants and the non-polyurethane implants and examine the outcomes of complication rates and patient satisfaction rates. We hypothesize that polyurethane implants are superior to alternative implants. And the clinical implication for this study is to promote the use of implant-based reconstruction after mastectomy by understanding the most suitable approach. So in summary, these are two critical areas of oncoplastic breast surgery. So first, the volume displacement and volume replacement techniques in oncoplastic breast-conserving surgery, and secondarily, the polyurethane implants in reconstruction after mastectomy. And I would like to thank you for your attention with my quote, which is, every turn in life is a chance to shift into something extraordinary. Thank you.
My question is regarding your second project. So you mentioned that mastectomy went up from 10% to 25% or somewhere there. So what was the reason of this really significant increase in mastectomies?
Yes, thank you for your question. So first of all, women who underwent mastectomy have a lower chance of recurrence rate. That's the first point. And of course, if the tumor is larger, then they should go under mastectomy and not the OBCS techniques, which I mentioned in my first project.
Yeah, I completely agree what you answered, but this is a known fact. This has been a known fact, let's say, for 50 years or for 60 years. Everyone knew that if you perform a mastectomy, then it's safer for the patients as far as the recurrence is concerned. But still, we did not perform the mastectomies because of the patients would not like to have them. But now it's a clear trend going towards mastectomy again.
Yes, because many...
Or sorry to interrupt, or we detect the tumors in a greater stage, in a bigger stage?
Yes, unfortunately, yes. That's what I wanted to say, yes.
And my second question is that we mentioned that polyurethane implants and the other ones are alternative. So what are the alternative ones?
Alternative implants are regular silicone implants or like gummy bear implants. There are many other implant types which we would like to compare with the polyurethane ones.
So is volume replacement or displacement a choice of preference? Or are there cases where you don't have a choice?
So I think surgeons should prioritize that technique which they are mostly comfortable and confident with, but they should also consider the patient's characteristics, the patient's breast size, and also the tumor's characteristics, the tumor type, the tumor parameters, and yes.
Mm-hmm. But that usually is a choice, because that way your results can be implemented.
Yes.
That way. Thank
Yes.
you.